Safety first.
All right, ma'am. Today we're just gonna go do what we call a gross range of motion and manual muscle test. We're gonna just put you through a few motions and I'm gonna apply a little resistance through them, okay?
Okay.
Okay. If you experience pain at any time, just let me know, okay?
Okay.
Okay, could you bring your knees close, this knee close to your chest as much as you can? Okay, bring this knee close to your chest. Okay, bring it up to my hand. Don't let me move you. Okay, bring this one up. Don't let me move you. Okay, I'm gonna try to lift up your leg. Don't let me lift it up. Okay, this leg. All right. Okay, bring your legs together. I'm gonna try to pull them apart. Don't let me move you. Okay, bring your knees out. Okay, I'm gonna put them together. Don't let me move you. Okay, bring in this heel like this, inward. Okay, don't let me move you. Okay, can you kick it out like this? Don't let me move you. All right, this one now, kick it in. All right, kick it out. Perfect. Okay, can you bring your legs in like this and then kick them out? Awesome. Can you bend this one a little bit, or kick it out for me? Bend it a little bit. Don't let me move you. Kick this one out a little bit. Bend it. Don't let me move you. Kick it in. Don't let me move you. Let me move you. Okay, can you push on the gas pedal like this for me? Perfect. Okay, don't let me move you. Okay, now kick your toes up like this. Perfect. Okay, can you put your ankles in inward like this? Okay, don't let me move you. Can you do this one? Okay, can you kick your ankle out like this? Okay, don't let me move you. Okay, can you curl your toes like this for me? Perfect. Don't let me open your toes. Okay, can you extend them up like this? Okay, I'm gonna push them down. Don't let me push them down. Can you spread them apart for me? Okay, I'm trying to put them together. Don't let me move you. All right, perfect. Hello, ma'am.
Hi.
Okay, today we're just going to do active range of motion of your hip flexion.
Okay.
Okay, first thing I'm going to do is I'm just going to locate the fulcrum, which is at the greater trochanter. Right there. Alright, perfect. Okay, proximal arm is at the lateral midline in between your ASIS and your PSIS. And the distal arm is lateral midline of the femur, interior lateral epicondyle.
So when you're standing there
What I
normal,
have to do is, could you flex your hip for me?
Yeah, probably.
Perfect. Awesome. Thank you. Normal range of motion of hip flexion is 120 to 140 degrees. This patient measured at 122 degrees, meaning she was normal. Hello, ma'am. Today we're going to be measuring your passive range of motion, external rotation of your
Okay,
hip.
great.
Okay, I'm just going to align what this is called is a goniometer.
Love it.
All right, I'm going to align the fulcrum at the distal aspect of the patella.
Okay.
The proximal arm will be perpendicular to the floor.
Okay.
And the distal arm will be in between the two malleoli.
A picture of it, of his rotation?
0.
Do external.
Her leg inward like this.
Gotcha, just make sure that this stays parallel.
Yeah.
This way perpendicular. Perpendicular or
So you
parallel.
can do that.
Yeah.
These are like,
Make sure your hips not up.
I feel like this is not, wasn't parallel
Okay, do again.
from what I was, like my angle was.
Normal range of motion for adults is 32 to 50 for external rotation. This patient measures at 39, meaning she was normal.
Yeah, I think
do your talar eversion, okay? I'm just gonna line you up.
What's the range
Fulcrum
of motion for eversion?
between the malleoli. Proximal arm is located at the tibial tuberosity
0 to 20.
and the distal arm at the second metatarsal. Okay, so I'm just gonna have you evert your ankle for me. Perfect. Just line my arms. Normal range of motion for tarsal eversion is 15 to 20 degrees. This patient measured at 10 degrees, meaning she is hypomobile. All right, next we're going to test your passive range of motion of your subtalar. We're going to do inversion. Okay, so my fulcrum is going to be between the malleoli. My proximal arm is posterior midline of the lower leg, and my distal arm is posterior midline of the calcaneus. So let me just locate your joint here. Okay, now I'm just gonna invert your subtalar.
Did I have your feet off the edge?
Are you supposed to?
I think it's on you.
I don't think it matters because you're just bringing.
Right.
Oh yeah, it does actually because you want your hips completely flat, and if your heels are up, you're gonna be raised a little. Sorry.
Right, perfect. For this patient's subtalar joint inversion, they measured at 25 degrees.
Gas pedal up to the ceiling. Go and move it.
Alrighty, ma'am.
Hi.
Today we're just gonna do a manual muscle test of your ankle inversion.
Okay.
Okay, so can you invert your ankle for me?
I'm trying to like
Awesome.
do it
I'm gonna
too
apply a
so
little
that
bit of
you can, like,
resistance.
see the
Don't let me
valence
move you,
and,
okay?
like here where I'm blocking, you know? And don't let me move.
The patient was able to complete full range of motion and held against maximum resistance. Therefore, they are graded as a 5. Alrighty, I am back again.
Hi.
Hi. Okay, what we're gonna do is we're gonna test your knee flexion. Okay, what we're gonna do is I'm just gonna have you bend your leg as much as you can. And then, okay, we're gonna run through that. Perfect, full range. Alright, can you bring it out a little bit? Okay, I'm just gonna apply resistance. Don't let me move you, okay? For this test, the patient was able to complete full range of motion, however could not tolerate any resistance. Therefore, she would receive a grade of a 3. Hello again, ma'am.
Hi.
Hello. Today we're just going to do what we call a manual muscle test, okay?
Okay.
I'm just going to have you run through a motion real quick, and then I'm going to apply some pressure and see if you can keep it in motion, okay?
Okay.
Okay, so what we're going to have you do is I'm going to have you lift this leg up as high as you can, and then I'm going to apply a little pressure, okay? Can you lift your leg up? Cool. Alright, so since you can't do it against gravity, we're going to put you in this side lying position and see if you can run through that motion again, okay?
Okay.
I'm just going to stabilize you here and hold your leg like this. Okay, can you bring your leg back? Perfect. Since the patient is able to complete full range of motion in this side lying position, they are considered a 2. Hello, ma'am.
Hi.
So today we're just going to do a muscle length test of your hamstrings called the SLR test, okay?
Okay.
Okay, which we're going to do is I'm just going to lift your leg up and we're going to just kind of keep your leg straight, but we can keep both legs straight as I lift this leg up, okay?
Okay.
Okay, if you pass 68 to 80, then you're good.
Okay.
All right, so I'm just going to lift this leg up, keep that one, the other leg straight, okay? Since the patient was able to achieve 68 degrees without any posterior pelvic tilting, lumbar spine flexion, or knee flexion, they are considered negative for this test.
Am I good?
You're
I,
good. Hello again, ma'am.
hi.
Today we're going to do what we call a SLR. This is not the SLR test. Alrighty, ma'am. Hello again.
Hi.
Hi. So today we're going to do what we call an Eli test. All right?
Okay.
What we're going to do is we're just going to flex your leg. It's a stretch test on your rectus femoris, okay?
Okay.
We're going to do it on this right leg right here. Okay, what I'm going to do is I'm just going to bend it. If it passes 90 degrees, you're good. Alrighty?
Alright.
Alright, so I'm just going to grab this leg here and we're going to bend it. Feeling for any hip flexion. Since the patient was able to achieve flexion of past 90 degrees without any hip flexion, they will be considered negative for this test.
Hi, my name's Tatiana, and I approve this message.